Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, most Americans will experience back pain at some point in their lives. It's one of the most common reasons that people go to the doctor and also miss time off of work. But on the bright side, measures can be taken to help lessen and heal back pain, or even prevent it. Here to talk more today about back pain is Dr. Douglas Chyatte. Dr. Chyatte is a neurosurgeon from Mayo Clinic Health System. Dr. Chyatte, thanks for joining us today.
Well, thank you so much for having me.
Well, let's start out first by finding out exactly what makes up the spine.
The spine is actually very complicated. It's made up of bones that we call vertebrae, and these are sort of block-shaped bones that are stacked on top of each other. And in between those bones are the discs, and we've all heard of discs, and those are held together by ligaments, and then we have muscles that provide strength.
You talked about discs, and a lot of people have heard of those. What is a disc? Is it a bone? Is it cartilage? Or is it something else?
Yeah. The discs are the largest avascular organ in the body. And a disc has an outside layer that's made up of very strong connective tissue, just like the ply in a radial ply tire, and the inside portion of the disc is soft gelatinous material.
And the purpose of the disc is to?
Well, the disc is commonly thought to act as a shock absorber, which it does, but the disc also allows the bones of the spine, the vertebrae, to move on each other.
Okay. Well, so I'm going to throw a really, what seems like a simple question to you. We're talking about back pain. What are common symptoms of back pain? Because that's a pretty general term.
Back pain's very common, and I'll bet that almost everyone listening to this show has had a backache from time to time. Most of the time, back problems are caused by the degenerative process that we all get as part of the maturing process and as a result of good, honest work and sports and that sort of thing. In its simplest form, a back problem may show up just as a backache, and that could be due from a muscle strain or a muscle pull. As the discs degenerate and the bones degenerate, those changes can also cause back pain, but they can also start to put pressure on the nerves. And when they do put pressure on the nerves, people can develop a condition that we call sciatica, and that's shooting pain down the leg from a nerve being pinched. Sometimes those degenerative changes can get so bad that it can actually crowd all the nerves and produce a condition that we call lumbar stenosis. And stenosis is a fancy word that just means narrowing. And people who have that stenosis condition may have pain down both legs and may actually have trouble standing up straight. They walk sort of bent over.
The degenerative conditions that you're talking about, is that the vertebrae actually wearing down or becoming smaller, or is it something else?
It's a little bit of everything. The discs wear down, and as part of that wearing down process, they may lose some disc height. The bones start to wear out, and as part of wearing out, they may develop bone spurs. The ligaments that hold the bones and the disc together may also wear out, and as part of that, they may hypertrophy, and that's a fancy word that means overgrow.
The degenerative conditions, is it, are people more prone to it as far as genetics, like family history, or men versus women, that kind of thing?
There are many factors that predispose patients to back problems. Genetics is a very important factor. There's not a lot we can do about our genetic makeup. Age is also a very important factor. You know, back problems are the result of a progressive degenerative process. Now, unfortunately, we can't do anything to control our age. There are some other causes of back problems that are preventable. For example, there are some lifestyle choices that predispose people to back problems. Obesity, which we're hearing more and more about in the media these days, puts extra strain on the back. And people that are obese are much more likely to have back problems than people who are not obese. Other lifestyle choices, such as a sedentary lifestyle, may put people at risk for developing back problems.
Back to the symptoms again. You talked about the pain not only being in the back, but also sometimes actually being in the legs. And I think a lot of people may not realize that when they think of problems with their back, that it actually could be pain in other extremities, not in the back.
That's correct. One of the important functions of the back is to protect the spinal cord and the spinal nerves. And the spinal nerves that run through the back will eventually go out to the legs. And when those spinal nerves are pinched either by a ruptured disc or a bone spur, that pressure on that nerve can actually refer pain down the leg.
What about a bulging disc? I've heard of a bulging disc before. What is that?
A bulging disc is a term that describes a degenerative change in the back. And the terms we use to describe back problems are very confusing. You know, I've been in this business for, gosh, almost 30 years, and I get confused by all the terms. In general, however, if we try and make some sense out of all these terms, there's a group of terms that describes anatomic changes that occur in the spine, and there are another group of terms that describe the functional consequences of that. So for example, a term that would describe the functional consequence of that might be a backache, pain in the back, sciatica, pain in the leg. Anatomic terms that describe the degenerative process might be something like bulging disc, herniated disc, ruptured disc, bone spur, arthritis.
Well, you know, we've all heard of, or we've even used, things like hot and cold packs or heating pads, those kind of things, those sort of home remedies to help with back pain. At what point should someone go see a doctor with back pain?
Yeah, that's a terrific question. You know, I'm going to guess that just about everyone in our audience today has had a backache at some time or the other, and they know that it usually lasts for a few days, and if you lay low and sometimes take some over-the-counter medications, it'll usually blow over. But there are some red flags that we really need to be aware about that should trigger a visit to the doctor. One of the most important red flags is the development of a neurologic deficit, and by neurologic deficit I mean weakness in a foot or a leg or inability to control your bladder or bowels. Some other red flags that that might prompt an early visit to the doctor are a history of trauma. So for example, if you were in an automobile accident and immediately after that you develop pain in the back, you may have a serious injury in the spine and may need to visit the doctor. Another group of red flags are having a backache in an unusual context, and by unusual context I mean other symptoms that may suggest a more serious systemic illness. So for example, a backache that develops after a prolonged fever, it might be wise to visit a doctor in that situation. Or a backache that develops after a period of unexplained weight loss, it might make sense to visit a doctor. And lastly, you know, if you've had just a backache that's not getting better or the pain's very severe, then that would be another reason to visit a doctor.
So if the back pain is not the sign of something more serious, what are some common ways that people can treat it themselves at home?
Yeah. One thing that people can do is restrict activities a little bit, lay low, if you will. Some of the over-counter medications may be helpful, things like Tylenol or ibuprofen. A lot of the pain in the back is caused by muscle spasms that we get, and if you can relax those muscles, it may help with the pain. So heat and massage, you can get a massage at home, a spouse or a loved one to give you a massage. That may be very helpful.
How about exercise?
Exercise is helpful in preventing back problems, but it may actually exacerbate things if you're in a flare-up with an active back problem.
Now, you are a neurosurgeon, so you perform back surgery. At what point is a patient eligible for back surgery? When is surgery needed?
Surgery is needed in some emergency situations. For example, we spoke about patients who develop an acute neurologic syndrome, weakness or inability to control their bladder and bowels. That may need surgery right away, and surgery may be the only good treatment option for that patient. In general, however, most patients who have back problems from degenerative causes are probably best served with trying a little medical therapy first.
So let's talk prevention. What are some good ways to prevent back pain? We can't prevent ourselves from getting older. But there's got to be some ways to help prevent or at least slow the process.
Avoiding obesity and making sure we're very close to our ideal weight is very important. The extra weight associated with obesity puts more strain on the spine and causes it to wear out more quickly. Obesity is bad for a whole variety of other reasons. It increases your risk of diabetes and heart trouble and those sorts of things. Exercise is also very important. If we can keep ourselves fit, that also helps to reduce the incidence of back trouble. Low impact exercises, bike riding, swimming, are good ways to stay in shape. Sports that involve a lot of quick starting and stopping, what we call high impact sports, may actually put a little extra wear and tear on the back as well.
So Dr. Chyatte, the back's it's pretty large. We've got the lower back, the upper back, and the middle portion. Is there something that you see that's more common as far as back pain? Is it in the lower or the upper?
Yeah. Pain in the lower back is much more common than pain elsewhere in the spine. And that sort of makes sense when you think about how we're designed and how we walk, that most of the weight and most of the forces that we experience are going to be in the lower back because they bear all our weight and all our activities. So the lower back tends to wear out a little sooner and get aggravated a little more quickly than the neck, for example.
So let's say I'm having constant back pain, perhaps even pain in my leg, and I come in to see a physician like yourself. What's the next step? What happens? What can you recommend for me?
The next step would be to make sure we're not dealing with an emergent situation. And we could do that just through a history and physical exam, make sure your strength was normal and that sort of thing. If it's a relatively new problem, we may recommend some simple medicines, Tylenol or ibuprofen. Sometimes we prescribe another sort of medicine to reduce inflammation that we call steroid. Physical therapy seems to be important in treating both acute back problems and also preventing flare-ups in the future. Physical therapy in the acute setting is often directed at trying relieving the muscle spasms that are very commonly associated with backache. Chiropractic treatment, osteopathic manipulation, those are all other things that could be considered.
And what are the shots?
The shots are another mechanism to deliver a drug to reduce inflammation to the spine. One way that we can do it is to just give you pills by mouth, and an alternate way is to inject the drug directly in the spine.
What does arthritis have to do with back pain?
Arthritis is a term that encompasses a whole host of diseases. And by and large, when we're talking about the back, we're talking about degenerative arthritis, what we call osteoarthritis. So changes that occur from activities and honest work.
Probably a lot of it is so much internal too. Is there anything physical that patients may see with their back, swelling, redness, that kind of thing as well?
It's unusual to see swelling or redness in the back. But muscle spasm is commonly associated with flare-ups in the back pain. And that muscle spasm can produce tightness in the back. It can produce a change in posture. Some patients will actually develop what we call a list, which means that their spine is twisted because the muscles are pulling it in a different direction.
Well, before we run out of time here, any last minute words for folks who may have back pain or may want to prevent back pain from occurring in the future?
The most important thing we can do is focus on preventing back problems. We're all going to get back problems from time to time, but if we can avoid obesity and keep our weight very close to an appropriate weight and stay fit, that's going to really hold us in good shape for our whole life.
Well, I'd like to thank our guest today, Dr. Douglas Chyatte, neurosurgeon from Mayo Clinic Health System. A great topic today. Thanks for joining us.
Thank you for having me.
Have a great day, everyone, and be healthy.